Inama, where health innovation meets cultivation. One of the questions I get pretty often is, how did you get into consulting? And another is, will you ever go back into a traditional working space? Okay. So, I think that there are quite a few things that aided me into looking towards consulting. I think I got to a point in my career where I'd worked in corporate America, hospital systems, US government, and then I went on to social enterprises and non governmental organizations, which focused on community health and also biomedical health systems globally. Upon doing so, and also gathering and earning new titles of the at the director and executive level, I realized that we were always hiring consultants and contractors who had more flexibility in their lives and also charged a daily rate, sent an invoice, and that was that. And so I think one of the first questions I got when I said that I would be starting Cultivatics 5 years ago was, well, what happens with your health insurance if you're not with a company? What happens with your retirement savings? What happens? All of these things that we are conditioned, and these are social constructs, we are conditioned to think are so important for everyone or needy or needed for everyone or is a priority to everyone. But I knew for me that my priorities were that I wanted more flexibility in my life. Okay. And even as a consultant or contractor, I'm able to say I'm not working this Friday. Or I prefer to maybe do some work at night and not work the traditional 9 to 5. There's a lot of flexibility that I've had well before the most recent pandemic that has aided me in really enjoying my work a lot more. I didn't feel the pressure of being in an office. And if I do go into an office or go out for meetings, that's fine in person. I actually enjoy that sometimes, but for the most part, I liked being the autonomy of me being able to make my schedule, and as long as I get my work done, that's important. Another thing was that I liked with consulting and contracting that you have a statement of work that you're working towards. You have these objectives that are very clear and these deliverables that are very clear. It's not really a catch all, unless it is a catch all. And I haven't taken any that are. And what I'm saying is, you will receive a statement of work, or I've received statements of work that say, this is what's expected of you, and this is what we wish for you to deliver, and by this date or by this deadline. Okay? And within the statement of work, we will allot you this many days or this many months to do this. Okay, so that's another thing too, is that some contracts are longer term and some may only be 2 months long. I've had a couple that are only a week or two long, and I like that because I can see and plan for the rest of the gaps within my month or my year. Okay, so like right now, I know how many months I have under a couple consultancies, and that after those, I will need to pick up another consultancy to continue my work for the year. Or if I wanted to, and I have before, taken a month or two off where I've done other activities or other focus areas like moving and taking care of my family and focusing on myself and being of service to my community. Those were options for me. And I know that I got to a point in my career where it became a privilege for me and that everyone doesn't have that opportunity. So to go back to hearing the comments of, well, what happens with your health insurance if you're not under a company? I don't know if I'll ever go back to a company. I may if the right opportunity comes along. I'm not saying that I will be a contractor full time forever, but I will definitely always continue doing consulting, even if it's on the side if I did go back to a company. Thankfully for me, the health insurance isn't an issue. I have health insurance, and you can buy health insurance, so you don't have to be with the company to do so. Or if you have a spouse, in my case, that has health insurance with his organization, that works out great too. But if he didn't, there you have options of that. And I think coming from the U.S., where healthcare is so expensive, it's one of those things to think about. It really is. I'm living abroad, and healthcare is so affordable just to pay out of pocket. And in the 6 years abroad, we've never used our health insurance at all. Even though the health insurance is an international health insurance that we can use anywhere, we've never touched it because it 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 takes um, more work for you to file a claim and to do all that than it does to just pay the $10 for a teeth cleaning, like it's or $8 for a teeth cleaning. So, um, it just worked out that way. But if I were in the States, would I be consulting? I probably would, because that was one of the first places where I saw people come in and they said, "This is my daily rate." And we said, "Well, we can't pay you that rate." And they said, "Well, it's my rate. If you want what I do, this is my rate." And I was like, "Whoa, that's pretty bold." And so I learned about negotiations better, and I learned that how do you calculate what that rate would be. And it was definitely something that was, and I wouldn't say it was scary at first, but I just didn't know what to expect at first. And then now I'm like, wow, I should have been doing this all along, because I'm still able to support some of the same organizations and donors and funders that I worked for before, or that I partnered with or collaborated with before. And it's awesome because I get to still remain abreast in my field and with some phenomenal people working in health and innovation. So that's just a little bit about how I got into starting Cultivatics, and how I became a contractor, a full time contractor now, full time consultant now, and how it's really helped the flexibility of my work life balance. I'm wishing you well, be well, and I hope you continue evolving in your light.